Welcome back, Smile Mentor family. Today we are having our PMMA try-in. For those that are new, wondering what in the heck this is, you might have hopped on for our first video. This being it, we've already done the surgery, so this is about the all on X, all on 4, full mouth restoration on implants. So I had my top row done. They did the surgery. 24 hours later after the surgery, I got put in these temps because that 24-hour gap, they put me in a temporary, I guess is a good way to put it.
Yes, I mean the immediate load, and then now, after a healing process is completed, we're going to redesign your your teeth, because this one should be completely adapted to the new position of your gum. Sometimes we need to change the implants, or we have whatever may happen in the healing process. But in this case, we have the full set of implants that we placed since day one. So we have no changes with that, but we have changes with the position of your gum because your ridge is healed now, and everything changes a little bit in that process of the usually 3-6 months. Okay, so now the new set is completely adapted to the new position of your gum, and we are copying a little bit what you like and what you don't like from the ones that you're wearing right now.
Yeah.
And if this one is good, we proceed with the same design, different material.
Yeah. So 5 years from now, will my gums be in the same position? What's the likelihood of that, or do they change over time?
Okay, so usually if you have no teeth, your ridge will reabsorb constantly, okay? But in this case, because you have implants, so that reabsorption process is going to stop and you will maintain the bone level. Now, when you do extractions, you will have this remodeling of your ridge immediately after the extraction. So usually the major changes occur in the first 6 months, between 3 to 6 months, okay? So that's what the literature says. Sometimes 1 year, okay? But after that, very minimal changes, because your bone is going to be stimulated by the implants, by the movements, by your bite. So it's like a muscle. If you don't use it, you lose it. So if you have no implants or no teeth and no function, or basically if you have dentures, complete dentures, removable dentures, you will lose your bone. Your ridge is going to become thinner and flatter, okay? So if you have implants, you maintain it much better.
What about the gum level? So the gum, so I know the bone's going to hold a little better. Do the gums ever resorb anymore after time goes on?
Remember that the bone is like the table and the gum is like the tablecloth. So if you maintain your bone, your gum usually is going to be dependent on your bone. So if you have, for example, the bone here, the gum should be, generally speaking, 3 millimeters above that.
Okay.
If you have a bone defect, your gum will follow that bone defect, and it's going to be 3 millimeters on top of that bone.
Okay.
Okay, so if we lose bone, we lose gum. There's no way to keep it without bone. Yeah.
Okay, perfect. That answers that.
Okay.
Okay, so today we're trying in the PMMA. Will I feel? Is it less? Because these temps. I almost was thinking about the appointment today. I've seen a lot of these appointments, and most people have not had temps like I have had in the past. And so, are these pretty close to what the PMA will feel like?
Okay, the ones we have right now were done the day of the surgery. So the gum position was different. So maybe, or usually at this point, you will have a huge gap in between the temp and the gum, because as we just said, the gum shrinked, everything shrinked a little bit, so you have a bigger space there, okay? So this one, if, for example, in your case that you liked those teeth, we're going to follow the same aesthetics, but the adaptation will be much better. So the sensation for you is going to be much better because you won't have that air passing through, less food packing in between the teeth and your gum. So it's going to be easier and nicer for you right now, okay?
Does the prosthetic itself, is it different shaped? I know the front will be the same, and I know it'll tie into the gums, but is the back part behind the teeth, is it same?
Sometimes it's different, yes. Why? Because not in your case, but in some cases, we only load some of the implants, not all of them, okay? So for example, the second set, or this set, what we call the trial PMMA, is going to be designed with more teeth. Is going to be designed depending on the parameters that we need for the final material. The immediate load, or the one that you're wearing right now, is going to be designed based on function and trying to risk as less as possible your implants. So sometimes we make that one thicker, so it's going to be stronger. The bulkier, the stronger for the material. So it's going to be a little bit different design. Okay, so this one may be thinner, you know, like more adapted. The thickness towards your palate or your tongue is going to be different, but this will be determined by the final material. Okay,
Perfect. Got
so
it.
sometimes this plastic is going to be weaker than the one you're wearing right now because it's different thickness. Okay, so this one we just use it for 2 weeks just to see everything fits good, do you like it, and we proceed for the final. We proceed with the final material in the same design.
Are there any eating restrictions with a PMMA, or should you eat like you normally eat?
Okay, remember, we always say the plastic fork rule. If you can cut it with a plastic fork, you can eat it. I didn't say knife, fork, okay? So if you can cut it with a plastic fork, you can eat it. This one, as I said, is weaker than this one, okay? But usually, you get used to this one and then you start bending the rule or breaking the rule because you feel confident and you have no pain. So this one, sometimes you already broke that rule a little bit, but this one you should be very careful because it's thinner and it's weaker.
I thought the plastic rule or fork rule was just for the osseointegration or for the implants to heal. It's for the material.
Actually, it's for the material. What happened? Okay, right now your implants are already healed, okay? So worst case scenario, you will break your temp and you will be without teeth.
Right.
But the implants won't be under any risk. But this one is, the same. You will break it and the implants, nothing will happen with the implants, but you will break the teeth and you will be without teeth.
Okay.
That's the only issue now.
Right.
If you break the plastic during the first 3 months, it's going to be risky for the implants because everything will start moving individually and implants are very soft. Remember that we discussed once that we have the implants, and at the beginning when we place the implants we have what we call primary stability, so it's like mechanical stability. Then your bone or your cells will start eating that bone and forming new bone, and that process in the middle of that process, and we're talking like the 4th week, you're not going to have enough primary stability because you already ate a lot of those bone cells.
The osteoblasts.
Exactly, the osteoclast
Are the
ate
ones
a lot
that
of
eat.
Okay.
Close.
And then the osteoblast is the one forming bone.
Okay.
You already started forming bone, but not that much yet.
Right.
Okay, so you don't have primary stability and you don't have secondary stability. So that's the 4th week.
The biggest vulnerability that
so
you
imagine,
have.
at the 4th week, you already forgot about the surgery and you have no pain, no issues. So some people start being very confident with let's see this and that, and they break the temp. And if you break the temp when the implants are so soft in the bone, implants may fail.
Yeah.
Okay?
Okay,
so let's...
That is the thing.
Like, open. Minor adjustment, basically here. How do you feel your bite?
I don't feel it on the back at
Okay.
all. Everything's
Okay.
resting up front.
Let me show. Remember, these are the plastic ones, and the shade actually is a little bit lighter because they use a bleach shade to print this material. So you may notice it's a little bit wider. Of course, the other one was already a little bit stained, and this one you're going to notice is lighter than the other one.
Okay.
Let me show you with the mirror. Where is it? Here.
So you're saying they're bleach white?
Yeah.
All right. Those are white.
That's a very simple thing to modify, of course.
Yeah.
You have a little sharp edge over there.
I like you, man.
Yeah. Okay.
Maybe
So-
bottom row look nice and yellow.
So basically, what we need now is that you try those, your bite, the function, how you clean, all that, okay? So if everything is good, we can proceed with the same design for the final restoration.
Okay.
I already noticed a couple of things that I want to change because when I placed it, I don't know, midline, this and that, so I'm already planning to do some minor adjustments on the design, but I need your feedback after
Okay.
you use it for a couple of weeks.
Which is a point I wanted to share with our viewers, is that this is not just the doctor doing all the work. This is the patient has a role to play in the success of this.
Yes.
Not just the hygiene, which is very important, not just eating properly, meaning
Taking care of
yeah,
that, yeah?
taking care of it, but also taking good notes to give you guys feedback. So what are some things you said? Bite. I'm going to want to pay attention to bite.
Yes.
What else do I want to pay attention
Okay,
to?
to the bite, to the food packing, for example.
Okay, the
Okay.
food that goes up underneath.
Yes,
It
underneath.
happen a lot. Okay.
And that happens much more usually with the upper hybrids, okay? So that's why we need to be like very, the design should be easy to clean and trying to avoid as much as possible the food packing, okay? So it's like a balance. So now you will give me your feedback based on that.
Okay.
Okay, the bite. If you have any pain with your bite and this and that, that's of course pain or any kind
Sure,
of
sure.
symptom you should tell me.
Okay.
The aesthetics,
Okay.
the length, the speech.
The
okay?
speech. Okay.
Not in your case because you had all your teeth. All the implants were loaded, so we don't have like big changes. Okay.
Mhm.
But with other patients, sometimes we add more teeth in the back, we increase the length of the teeth, and we do changes that may modify the speech, for example.
Okay.
So I need to know that.
Okay.
Then the space in between, if the air is passing through, your speech will be different because you will start like whispering like, okay?
Okay.
So I need to know those things.
Sure.
And of course, every time we do changes in your mouth, you will have, your tissues like, what is this, Of course. So if you tell me right now, you will have a lot of concerns. But if you try those teeth for 5 to 7 days, your tissue, your tongue will get used to that new position and your speech may be the same again, like normal. So no issues. That's why we need to try it not for 5 minutes, we need to try it for a couple of weeks. So you need to get used to the new position of your teeth.
Okay.
You may bite yourself. Not in your case because you already had all your teeth, but most of the cases that we add teeth, your tongue during the healing process and your cheek, that both of them will contain food so you can chew. Now they have teeth again in that area. During the 4 months, 6 months, or okay, they were using, the tongue and the cheek were using that empty space and they were like muscles, okay? Suddenly you have teeth back and your tongue will try to go there and you will feel weird for the first couple of days. And you may bite yourself until your brain connects the new position and says, no, this is your position, this is your position, this is the teeth position, okay? So basically, that type of feedback is the one we're looking for in the
Okay.
second appointment, on the next appointment,
Perfect.
okay?
Perfect.
So now we're going to take some pictures,
Okay.
extraoral pictures, just to check and verify that the little changes that we did, the line, the midline, the smile line, and all that is good. And then if we need to do changes, we'll have that as a parameter because we have the previous picture, we have that picture previous to surgery, and we have all those pictures documented. So we have all the lines, the changes that we need, that we did, that we are going, everything's there.
One quick question before we go do that I was thinking about, and because I remember one of the patients had this issue, and I don't remember how you guys resolved it, but they traveled a lot, and so they had a backup set. Was it their temps? If somebody was to travel a lot and God forbid anything happened while you're traveling, that you have a backup set that somebody you can go and somebody can screw in, a professional, not yourself, of course, but having that, is that usually your temps? Is that a bad question to ask? No, I'm going to make a high maintenance customer.
I mean, sometimes we do that, of course. For example, with these type of temps, if you're going, for example, we place the implants and we do the immediate load, and then you tell me, I'm going to be out of the country for 1 year, this and that. So I said, okay, I'm going to give you exact set, like the copy of that, because we just printed, this is digital, so we can print the same exactly copy of what you have.
Okay.
And you will have a spare denture, spare arch, whatever, however you want to call it, just in case. And then, of course, now we already have one. The one I just removed is your backup, just in case you break this one, and I need to do whatever, I put that one back.
Perfect.
And then, when we do the final, you will have two.
Perfect, okay.
So we usually keep those here in your files. Okay. So we have everything, and we only have, we also have, we have those physical teeth, but we have all your files. So whatever we need to redo, we just one click and we do it, okay? But if you travel, we can give you one of those.
Okay.
Yeah.
Okay, perfect. All right, well, let's go take some pictures.
Let's go.
All right.
Let me take this out.